Good morning, everybody. Thank you to the 76,000 people who came forward for testing to 8 p.m. last night. That is an outstanding response, especially on a weekend. Unfortunately, New South Wales still recorded 98 cases of community transmission. 20 of those were infectious in the community. And please remember, that 20 number is the number we're really keen to nudge. We need to get ahead of that number in order to reduce the cases in the community, and the closer we get that number to zero is a signal that we can end the lockdown. So can I stress that it's really, really important for people to get tested when they have the mildest of symptoms, or even if you don't have symptoms but you live in a particular area and you're leaving for work, please make sure you follow the testing guidelines. It's so important for that to occur. Unfortunately, more than 2/3 of those cases are still in southwestern Sydney. And can I please stress, and I know this has impacted many families, that sometimes you don't even need to have symptoms to give the virus to your loved ones. So please, you might think you're doing the right thing by visiting a relative or going into another household. Please don't. We're seeing so many cases of families going through distress because they're moving from household to household thinking they're doing the right thing. But unfortunately, even when you don't have symptoms, you might not know you're carrying the virus. And as the health experts say, this variant, this Delta strain of the virus, makes you more likely to be transmissible or to be contagious or to spread it. So I can't say that enough. Please know, stick to your household, don't move between households. And please make sure you keep those you love the most safest. We're just seeing so many examples of entire households getting the virus and in distress because those that are closest to them are getting the virus because they've unintentionally or by mistake, unfortunately, spread the virus. And we really want to see that stop. And I don't want to see families and individuals go through the guilt and the distress and see loved ones impacted by what is, as Dr. Chant says every day, a very serious illness. So can I please get that message out as strongly as I can? I also know this week there will be special celebrations around Al-Adha, and I just ask families to please know, as hard as it is, I mean, I haven't seen my parents for a month, and I know that's very small compared to what a lot of families are going through. But I just ask everybody to please think about their loved ones. You might think you're doing the right thing, but we just need families to stay in their family home and not move from household to household because unfortunately too many people are getting sick from that. And the second highest example of transfer of the virus at this stage is in workplaces. That's why we've put those rules around workplaces in particular. That's why we've had to ask some businesses to down tools until July 30, because workplaces unfortunately not only spread the virus to colleagues but potentially spread the virus to other communities because people from different areas are coming together at a workplace. And now some of these workplaces have been workplaces where people need to go to. And fortunately, we haven't seen a huge transfer to patrons, but definitely through work colleagues. So please, if we can just stress, be extra careful in relation to workplaces and also in relation to your own family members who don't live in your household. These are two areas we really need to focus on. And I'm convinced if we work together, we will see that number go down. We won't see the effect of the harsher, even though we've been in hard lockdown, we won't see the effect of the harsher restrictions for another 4 or 5 days. But I know they're there to be had if all of us stick together and work hard. And I also wanted to stress today that if you've been impacted in the last 3 weeks or in the last few days by decisions the government has made in relation to your personal work situation or your business, please know the help is there. So please know, if you're an individual, go through Services Australia to get those disaster payments, those immediate payments that come to you. And please go to Service New South Wales, and we understand there have been tens of thousands of people already on the phones this morning, and we ask for your patience. But if you're a business, please go to Service New South Wales to get the assistance you need to get those grants coming through. We know this is a difficult time for so many. We know that. All of us are in this together, and I just ask everybody to stick with it, and to be as patient as you can. But please know, no matter what you're going through, there is help for you. And no matter what you're going through, chances are there are other people in our community going through the same stresses. I know New South Wales is up for the task. I know we can beat this thing, but it does mean us listening to those messages provided every day and making sure all of us are doing the right thing. I'll now ask Dr Chant to provide her update, then Deputy Commissioner Warboys about the great work police are doing on the ground to support communities, and then we'll take your questions.
New South Wales recorded 98 locally cases of COVID in the 24 hours to 8 p.m. last night. As the Premier said, we've still had 20 cases that were infectious in the community for over 1 day. It is important that we get that number down. But it is pleasing to see that the venues have been narrowed and that people appear to be taking the health advice about limiting the time spent anywhere and also not going out when you're sick. COVID is a severe illness, and I just want to highlight the fact that what the Premier has said, that COVID can be spread to others even if you don't have symptoms. So we're getting a lot of misunderstandings that if I'm well, how could I possibly infect someone else? And the reality is you don't know. You don't know that you have the disease, and actually with this Delta variant, you're actually most likely to spread it to others even just before you've got, around that time when you've got symptoms. Before you have no symptoms at all, you are most likely to spread it. And so again, please do not visit anyone. What we want you to do is stay within your households. In terms of the locally acquired cases, the majority still are in southwestern Sydney Local Health District. And can I extend my utmost gratitude to the community of southwestern Sydney who have come out for testing and are actually bearing the burden of this impact of COVID on them and their loved ones. And I just want to acknowledge the way that the community is responding. But unfortunately, it is the Delta variant, with its transmissibility, requires us almost to be perfect at all times. So don't go and visit anyone else. Don't have anyone into your home. Please be so safe when you're going outside. Wear a mask and make sure it covers your nose and mouth when you're entering any indoor premises, queuing. Make your trips as short as possible. And remember that message about chemist shops, pharmacies. Don't go there if you've got symptoms. Instead, you should be actually going and getting a test. In terms of the cases by local government area, again, Fairfield local government area has 47, Canterbury Bankstown 13 and Liverpool 13, reflecting the fact that the disease burden in those areas is significantly high. We are seeing a lot of still the pattern that a lot of them are households. So once we find one case in a household, the remaining household members soon are almost positive at the time of detection or soon become positive. There are currently 82 COVID cases admitted to hospital, with 24 in intensive care. And of the 24 people in intensive care, one has had a vaccination, with one person having had a dose of AstraZeneca vaccine. Again, vaccination is critical. Can I just urge everyone in the community who is eligible for the vaccine to go forth and make an appointment. Go on to the eligibility checker and access the vaccine. I would urge anyone, in particularly over 60, to go and get an AstraZeneca vaccine from their general practice. And remember, I've also said that GPs are working very hard and they will prioritise older individuals over younger in terms of bookings because of the need to protect our elderly. But even one dose of the AstraZeneca can have some effect, as well as the one dose of the Pfizer, but 2 doses gives that optimal protection. And both having those 2 doses of the vaccine can really reduce your risk of hospitalisation and death associated with COVID. The areas of concern for increased testing are Lakemba, Punchbowl, Fairfield, Bankstown, Liverpool, Cumberland, Marylands, Guildford, Wollongong, Blaney, Parkes, Coffs Harbour, Crow's Nest, St Leonards, Mittagong, Burradoo and St George's River, Bayside and Sutherland Shire. And this goes to my final point, that we do need to make sure that we aren't complacent, that this is just an issue in southwestern Sydney. It is far from. What we need to do is every time we leave our house, be vigilant in who we interact with. We've talked a lot about reducing mobility, but in essence what we're talking about is reducing the opportunity of bringing people together, because that is ultimately how COVID is spread. Why we're concerned about workplaces is they bring together people from different parts, geographical areas, and so have those characteristics of potentially introducing COVID, if we have a workplace transmission event, into other settings and other communities. So whilst there will be the need for some critical work to go on, we do need to support the functioning of society. It is incredibly important that as we go about our workplace functions, that we take this threat seriously and follow the health advice. Thank you.
Good morning. Thank you, Dr. Chan, Minister Premier. 201 infringement notices issued in the last 24 hours. Of note, 121 of those in regional New South Wales, that's north, west and south of the Greater Sydney area. What I want to emphasise today that the strategy that police are working on is not a ring of steel. We are not operating on a ring of steel around Greater Sydney, not around any LGA, not around southwest Sydney. New South Wales Police Force has 17,700 employees, police officers that are competent, well-resourced, and every single day are provided taskings right across the state. When we look at the spread of those infringement notices, it shows that the concentration of police and their efforts around the pandemic is right across the state of New South Wales. New South Wales Police will continue to review those on a daily basis and move resources wherever is necessary. Thank you.
Dr. Chan, did you provide specific health advice to the government recommending they shut down government construction sites?
So New South Wales Health provided data that we needed to do more at reducing those mobility, and as I said, the key underpinning driver for that is the interactions between people. So what we indicated is that we needed to do more to reduce those opportunities for people to come together. We were also concerned that we had seen a number of outbreaks in workplaces which were further seeding other parts of Sydney. So that was the basis of the health advice, is we need to reduce workplace attendances. We need to reduce the opportunity for workplace transmission events to occur, and we need to ultimately stop opportunities for people to interact with other people.
Premier, are you confident, that you will...
Can we get an update on testing and the turnaround time for testing rates? It seems to be slipping a fair bit. What's your average turnaround time now? And are you prioritising southwest Sydney over other parts of Sydney?
So we've got a range of strategies in place, and we're working closely with the private system, which is doing a lot of the testing as well as complemented by the activities of the public. In terms of the turnaround times, we know some providers are taking some additional steps to improve their turnaround time, and we're working closely with those private providers. In general, the turnaround times are still holding up, but there is specific issues that are being addressed. And we, just to reassure the community that if you are a close contact and if you've been told by public health to go and get a test, please make it known that that's the reason you're there. We have mechanisms with all of the private pathology and some specific services we are running to make sure that you get tested promptly. Because, as you know, whilst we're doing a lot of surveillance testing, which has been very useful at identifying people without symptoms and potentially infectious in the community, we want to preserve the fact that our highest risk group are those that are in close contacts. And so just, if you are in the line, in any of the queues, please draw the collector's attention to the fact that you are a close contact and have been directed by public health. There are processes by which that will be written on the form, and the private pathology companies have ability to please to prioritise those specimens. I could actually say a request from the private pathologies is please do be patient. Unfortunately, when you are ringing up, it actually distracts some of their focus from logging the specimens and getting them swiftly through the machine. So I understand how it is a stressful time in someone waiting for a result, and people are quite anxious, but if people could be a little patient, that will help us get the turnaround times and maintain that high turnaround time.
Premier, are you confident that the measures you put in...
decision made by Crisis Cabinet is informed by the health advice? Could we just get a bit more clarity on how explicit that health advice is? So did you explicitly say to the government, I believe that construction sites are of such concern that we need to shut down the entire industry?
So in terms of the advice, we provide the advice in terms of the broad principles of what we need to see. We've highlighted the fact that I think that the disease burden is incredibly high in southwestern Sydney, and to some extent we can define the problems of what we're trying to achieve from a public health objectives, and then it's a matter for how whole of government puts input into it. I mean, clearly we're not the experts in logistic chains and other things, and so we need that whole of government approach to determine what things are critical, what things are not, and our objectives of decreasing workplace attendances, decreasing the opportunity for interactions is what we need to achieve. The matter for how that is done is really a matter for broader government. As you'd expect, we are not the experts on some of those factors.
Premier, are you confident that the measures you put in place on Saturday will do the trick, will do enough to get us out of lockdown over the next month or so? And did you consider at any point going the Victorian route on construction and, say, allowing 25% on site rather than the whole thing shut down?
Well, what's important for us is to respond to the critical health advice we received, and the critical health advice we received was the absolute risk of workplace transmission and the fact that thousands and thousands of people were moving around the community throughout Greater Metropolitan Sydney, and sometimes even outside Greater Metropolitan Sydney, on work which wasn't urgent or had to happen in the next fortnight. And what is really critical for the New South Wales Government and for our citizens to know is we're throwing everything at this to make sure we get out of this lockdown as soon as we can. And having the risk of thousands and thousands of people being mobile at the one time, many of them coming from communities who've had cases, was too big a risk. And I appreciate how difficult the decision was. I think I expressed very frankly yesterday that it was the most difficult day in the office when we made that decision. But we have to, if we're serious about allowing individuals, families and businesses to bounce back as soon as we can, we must take these difficult decisions, which we did. And I also want to assure the community that we are working with the construction sector on safe ways to go back to business on July 31. And I want to make that very clear. The Treasurer, the Deputy Premier, key senior public servants are meeting obviously virtually with the construction sector daily to make sure that when they go back to work, there are safe workplaces in place for large businesses, medium-sized businesses and smaller businesses. What we can't have is people, especially who may not even have symptoms, visiting multiple work sites, visiting construction sites with hundreds of workers and spreading the disease. And that is a threat that was too great. And given the health advice specifically related to reducing mobility, reducing workplace interaction, reducing household contacts, that is really key. And can I just make one point about households, which I should have stressed? Please make sure that you don't leave your household for those important celebrations that might be going on within your community. You have to stay within your household. Unfortunately, those closest to you, the ones you love the most, are at threat. So I just really urge everybody, in addition to making sure that we follow the health orders, especially in relation to work arrangements and also other matters, that we don't move from household to household.
Premier, Dr. Charles, on the construction issue, regarding those safety meetings that are happening, can that process be brought forward? Can it be sped up so that the industry could resume in some way before July 30?
Oh, look, we're wanting to make sure that industry is well supported in having those extra COVID-safe measures on site, including testing on site, including a number of other things which can be done. And obviously, the small and medium-sized businesses have different stresses on them than the larger ones do. The larger ones have a greater capacity for some of those testing arrangements and other things. And that's why it was important for us to take a pause so that the industry can resume and continue safely indefinitely, and that's our aim. But we knew that the risk of literally having thousands and thousands of people moving across sites, some of them across multiple sites, from parts of Sydney that had huge virus loads or huge cases within them, wasn't a tenable position. And if we're serious about having harsher conditions, if we're serious about quashing this thing, because what the lockdown had done successfully, which we needed it to do, was to stop what we call the rate of increase, the exponential growth, and we succeeded in that. We've stabilised the virus, but if we want to get out of this thing and have a normal life, we need to quash it, and that's why those extra measures were put in place.
Do you have any fear you can't quash it, Premier? Do you have any fear with the Delta variant? I mean, this is, in a sense, all of our worst fears.
Yeah.
That you can't get it to zero.
Well, look, we know the Delta variant is like nothing we've seen, and we know how challenging it is. But we wouldn't have thrown everything at it if we didn't think we had a chance of quashing it. And I know that if all of us work together, we can quash it. And I know how difficult it is. Believe me, every decision we take, it takes a deep blow on all of us to have to make these difficult decisions. It's not easy. It's not easy at all, but please know we do it in the best interest of our state, because all of us want to get out of this as quickly as we can. And I do want to stress that some of the cases you've heard in the last few days, including today in regional New South Wales, were people working at workplaces at multiple sites in critical work who may not have had symptoms but unfortunately were infectious at the time. And that is why we have to be alert and aware that this strain is different to anything we've seen. But I absolutely believe that if we come together and work hard, we can quash this. But that's why we're in a critical phase, and that's why the New South Wales government had to take those difficult decisions. And the settings we have in place are what we believe are the best ones based on the health advice, but the settings are what we believe we needed to do in order to reduce workplace transmission, reduce mobility, reduce household-to-household transfer. And I appreciate again how difficult it is, and today again our thoughts, whenever it's a Monday rolls around, in particular, our thoughts and my thoughts are with people, with households who are having to homeschool, in addition to having to do their own work. And there are plenty of teachers who are having to teach from home but also teach their own children. So the pressures on families and individuals and, of course, businesses is huge. And we don't take any decisions lightly, but we are throwing everything at this because we know we have a chance of quashing this, and quashing it is what we need to make sure we are, the objectives we have for our people is to live safely and freely until we get enough vaccines. So can I just make this point? Our objective as a government is to live safely and as freely as possible until we get the vaccination rates up.
Just on the vaccine.
Are you considering any ban on removalists travelling from Sydney to the regions, like the 2-week ban in Victoria, given at least 6 of the exposure towns that have been exposed are from removalists? That
is a concern for us, which is why Dr Chant made some recommendations in relation to travel to the regions, and that's why those 3 particular LGAs, people from those LGAs can't go to the regions for critical work as well, because obviously that is a huge concern, but there are instances where unfortunately people haven't had symptoms and yet they've travelled to regional communities and the virus has been spread, and that is a huge risk. Fortunately, until this point in time, people in the regions, although they've had to face restrictions they've not faced before, have by and large been able to move around freely. We want that to be maintained, and that's why the New South Wales government did take those further decisions to make sure not only that we protect those parts of Greater Sydney that don't have a huge number of cases, but also to protect our regional communities. And that all goes into our thinking, and that's why, as Dr Chant said, the health advice is provided in a whole of government context. And our objective, can I be very clear about this? Our objective is to have our community in New South Wales, our citizens, live as safely and as freely as possible until the vaccine doses arrive, and that is our objective.
On the vaccines, are you because we're about to get a whole bunch of Pfizer. Do you think you have, are you fearing having enough infrastructure in place to distribute that? People now take a couple of months to get a Pfizer appointment. And have you reconsidered what you said a few weeks ago about an 80% vaccination target in light of this outbreak?
Well, firstly, I'll say this, that fortunately today we have 2 more large vaccinations hub open throughout the state. So we have plenty of access points now in New South Wales. What we don't have is the doses of the vaccine, which we understand will be arriving in larger quantities in mid to late September. But in relation to our target, 10 million jabs, or 80% of the adult population, is about 60% of the population all round. And what we've seen, unfortunately, with the Delta strain is that younger people are getting it. In households, normally in a household other strains wouldn't have it transfer to children, but we are seeing that, and I will ask Dr Chant to talk about that, because that means we have to be on our guard in a different way than we have been before. And I will ask Dr Chant just to talk about that, because in previous strains we had not seen younger people get the virus in the way they are or transfer the virus in the way they are, and that's why vaccination in relation to the Delta strain won't necessarily just mean adults, which is where the 10 million jabs came from. It will also mean younger adolescents and younger children. And can I please ask Dr Chant just to make that point, because it's an important health message to show how different the Delta is compared to other strains.
Just before you hand over, though, can I just ask, though, so are you sticking with the 80% adult population? You think we need that to
Look,
open
we'll always take the advice of the health experts. We'll always take the advice of what experts around Australia and around the country are saying. But in relation to the 10 million jabs, nobody was prepared to set a target. We did in New South Wales. We've about 3 million jabs through. 10 million jabs is a jab number that we want to set as a target where we can consider completely opening up and living freely. But if there are, which again equates to about 62% of the population in total. So I want to make that point. 80% of the adult population, 10 million jabs only gets us to about 62% of the population vaccinated, which is why I want Dr Chant just to explain the threats of the Delta virus within children, and which is an important point. So I'll come back to answering questions, but I do want Dr Chant just to make this point from a health expert perspective so that we're all aware that this is now a deadly disease which impacts younger people.
So thanks, Premier. So just a couple of the characteristics of Delta strain is we are seeing more infections from children spreading, which is not the characteristic we'd observed with the previous strains. So that means we need to rethink and think about our role of vaccinating children. It's pleasing to see in some countries overseas that we have vaccines that are licensed for use in children. And I know the regulator, the TGA, is often considering is continually considering the vaccine. At the moment, we have a shortage of supply of the vaccine, but we do have adequate supplies of AstraZeneca vaccine. And I'm just urging our population coverage, even for the over 60s, is not high enough. And we have a good vaccine that can be used, where the risk of hospitalisation and death is very high as age increases. It is present across all age groups. So I just would urge people to go out and access AstraZeneca vaccine and go and have that discussion with your doctor. Obviously, the Delta strain transmissibility will make us have to rethink about the level of vaccination, and I think I'm alluding to the fact, or probably stating it clearly, that I think having vaccines available for children, particularly high school children, will be really useful in rolling out those vaccines. And I think we also need to get the community used to the fact that we'll be doing booster doses. So whilst we need to firstly get everyone vaccinated, shortly after, in 2022, we will be probably giving vaccines, more specific vaccines against the new variants of concern. So I think that we need to see that our journey of living with COVID is going to be a long one. We'll have to adjust to whatever the virus delivers us and respond. And that's why it's always hard to make fixed statements. But in short, I think there will be a key role for vaccinating children and also having booster vaccination rolled out quite quickly as well.
On that, Dr. Chant, when would you anticipate that children would get access to the vaccine, and would you anticipate that, say, the 30 to 39-year-old group, would they be jumped over? Would children go first? Or when would we get the 30 to 39-year-olds in your mind?
I think we need to work in sequence. What I'm highlighting is when we have no vaccine supply constraints, when we've done the hard lifting of vaccinating the adult population over 16s, concurrently, as you'd expect us to do, is we're thinking about the next group that we want to vaccinate. And I think you'd expect us to do that planning, but at the moment that is a long way off, because at the moment we are getting, pleasingly, to see some increase in vaccine availability in terms of Pfizer, but it's still, supply is constrained at the current time.
Public health order stating you need to Premier.
Sorry.
When on the 30 to 39s, do you anticipate that we will see them get access in New South Wales?
Look, I think we need to remember that we have to still prioritise by age and underlying conditions. Obviously, when there is no vaccine supply constraints, that will be a different thing, where it's basically whoever wants access will be able to get access. But we're not at that point at this time. And I think we need to, my clear message is, if you have underlying health conditions, if you're over 60, please call your GP. Just to let you know that GPs are working very hard, and I really want to extend my appreciation for GPs, and it's pleasing to see the pharmacists coming on board as well. But they will prioritise to the elderly potentially, or people with underlying health conditions, because that is the group that they need to target.
Premier, the public health orders clearly state that anyone needs to wear a mask if they are next to or near a food premise or a retail shop. Dr. Chant, I put this in the public health order because we're told we need to wear a mask whenever we might come into contact with someone. What does near mean in this situation? How can this be enforced? And if you're relying on people to follow the common sense and the intent of the law, shouldn't it be explicitly clear on what is near a coffee shop or when you need to wear a mask?
I think the health message has been extremely clear in relation to that, and I will ask Dr. Chant to reiterate the message we've been providing.
But Premier, if you need to wear a mask when you're queuing at the cafe, why did you feel the need not to wear a mask, Premier?
Firstly, can I say I expect everybody to follow the health orders, everybody, and can I also say they're very clear. And when you're outdoors and you're exercising, you obviously don't need to wear a mask, but if you're in close contact to anybody, no matter what you're doing, if you can't guarantee social distancing, you must wear a mask. But I'll get Dr. Chant to reiterate that message.
What does near mean in this situation, Dr. Chant? What does near a food premise mean?
I think, again, we would expect the community to apply as common sense. And clearly, when you're coming up, what we're asking people to do is when they're in proximity, you know when you're going to be coming across people, when you're in a busy environment, when you're queuing for the coffee shop. So clearly 1.5 metres is a distance that we would expect that you would start to do it. But obviously it's context. I mean, James, I think it's really important that the community, I think, understands the concept. COVID is spread less well in outdoor environments. What we want to do is give the freedom so that if you want to do a bush walk by yourself, if you want to walk along the beach by yourself, that you don't have to do it with a mask, you're not adjusting the mask all the time. We want to apply the science when you're in your household group to give you that bit of freedom. But we are asking the community to wear masks when they are coming into contact with anyone else, when they're likely to come into contact with anyone else. And I think the community is pretty good at understanding when those situations would arise.
But my question is, if you care about it so much and you put it in the health order, I mean, shouldn't it be clear? How on earth could that be enforced next to or near?
Seriously, James, taking an opportunity to have a go at the Premier's private life by getting a photograph when she was more than double where you are from us now is just silly. And can I just say that the media, with the exception of the Telegraph today, have been very good over the last 18 months. We know that the health orders are given as a guide to try and help the community get through what is a very difficult time. Some of them are precise and some of them aren't as precise as perhaps you would like. But common sense must prevail. I heard now nearly 12 months ago a comedian, not a journalist, actually say, why are we all looking for the loopholes here rather than actually just making it work? Common sense says stay away from people as far as is possible. And if you're 9 metres away, that's more than adequate. But actually, we talk about a 1.5 metre social distance. So if you need something that you can work on, James, work on 1.5 metres.
Minister Hazzard, the floor on the health order.
TikTok man picked the numbers 5 days straight, hasn't picked the numbers today. Have you found the obvious leak within government?
Well, can I just say it was a disappointment that on something as serious as our messaging to the community in a 1 in 100 year pandemic, that clearly someone, somewhere in the system, was feeling the need to disclose those figures to somebody who was not an appropriate person to be making commentary about it. I'm coming to you, Liz, just wait. And so Health looked at the issues around that. I saw someone saying in the social media that there was a sting. No, there wasn't. It was just looking at what the issues were and making sure that the system was such that that information could be kept to the appropriate time where the messaging to the community...
Why don't you release them earlier, Mr. Hazzard? Why don't you release them earlier?
Mr. Clennell, I don't need you interrupting when I'm speaking, thanks. So in terms of actually giving the message, an important message, which goes out at 11 o'clock each day in a way that the community would understand the significance of what we're asking people to do to keep people safe, I think is entirely appropriate.
Why don't you release them earlier?
I said Liz was the next one, Andrew. I don't need you
just
yelling
on
over everybody else.
Just speaking about the outdoor advice,
Yes,
there is clear advice that there's no real risk outside. Minister Elliott is.
Sorry, no, Liz. I'd say there is a risk. There's always a risk. What we do know. Sorry, can I just finish? What we do know is that the Delta variant can have up to 1,000 times the viral load in somebody's body, as opposed to, to ABC, to the previous situation, the previous variety of the virus. So it doesn't take a rocket science to work out that if someone can have up to 1,000 times the viral load in their body, it actually is a much more dangerous virus. So I would say the message that Dr. Chant and that I and the Premier have given is that if you can't socially distance outside, wear a mask. And socially distance is generally conceived at a roundabout, to assist the Telegraph and James apparently, 1.5 metres. But I'm quite sure that the other 6 or 7 million people who heard this message know that already. Ursula.
Those figures.
Minister,
can I just say, Andrew, you've had a go. I'm going to Ursula. Yep.
Could I ask about Katie Hopkins? She was obviously, the federal government today said it was the New South Wales government that invited her in. Is that correct? That
No,
gave her the exemption?
I think the way the process works, Ursula, obviously going back to about June or July last year, where Australia was a very favourable place to come for particularly Hollywood. We looked at those issues. We put in place a process where the film companies who are guaranteeing massive boosts to our economy and jobs can make application, as long as they do it in a way that is not going to impede on the number of Australians coming back. So if they can make arrangements to do that, and they can provide at their cost the safe arrangements. So what happens is that the State Emergency Operations Centre has those applications that come to them. They consider them, so that's public servants who are tasked with this very onerous job of trying to make sure our economy is well looked after at the same time as we're kept safe. They then make recommendations to the government, and they make recommendations that generally would pass. Sometimes it comes to me, sometimes it doesn't, or someone in my office. And if there's no objection from the State Operations Centre, if it can be done in a safe way, then it would generally get approval if it's got a big positive for our economy and for jobs. Having said that, can I just say, I was shocked to see that lady who, fortuitously, I've never heard of before, and I hope to never hear of again. To think that she could actually think that the measures that we are taking to keep our community safe can be treated with such juvenile, imbecilic behaviour is just mind-boggling. And to think that she could actually put our teams in our health quarantine, our staff. We have police, we have health staff. To think that she thinks it's acceptable to put them at risk and to put our broader community at risk is just completely abhorrent. And I hope she's on the first plane back. I'm sorry, you haven't asked me anything yet, and I'll come to you, James.
Minister Hazzard, how are our contact tracers going with the effort? We know that WA is assisting and South Australia is also assisting with the effort. How are they going? Because it's getting bigger each day.
We're doing very well. At the moment, there are obviously what you would refer to as tracers, but also case interviewers, We've stood up more than we've ever had before. I was just given the figure before I came down. We're up over 500 now, about 550. And I know we are grateful for any offer and any help that other states give to us, but I think we should also keep it in perspective. I think the offer from WA at the moment is 5. So our tracers are still doing an incredible job, and I think I want to place on record again, I think the broader community's thanks for the work that they do, for their sometimes multiple interviews, very calm and considered interviews, and often with people who, you know, in very difficult circumstances where they might have a family member who's on life support. So I think that we just need to keep that all in perspective. But can I say again, during the entire time of this pandemic, I have certainly never been critical of any other state or territory. I must say one of the ministers that I spend the most time with talking to is Martin Foley from Victoria. But Roger Cook from WA, they all do a great job, and we're working really well together. James.
On construction, Dr. Chan said earlier that in terms of the health advice, we provide broad principles, and then it's up to the whole of government to make a decision based on the broad principles outlined by Dr. Chan. So could you just give an insight onto why the government decided to go for an entire industry-wide shutdown of construction rather than the Victorian model of 25%, or a more stricter model which would have seen all tradies in south-western Sydney ring-fenced and allowed to go to work?
The process, and I think, again, I appreciate that it's complex, but, for example, Cabinet, and this is a subcommittee of Cabinet, takes advice from a whole range of sources before our Cabinet makes decisions. And the community would expect that a responsible government would do that. In the case of the Crisis Cabinet, the Crisis COVID Cabinet, we also take advice from a range of sources. So I know sometimes the media refers to it as just health advice, but there's the public health team, and that's led by Dr. Chan, and they've got a fantastic group of people working together. There's also the operational side of health. So it's not just one unit within health. There's a number of different areas within health that we take advice from. And also on top of that, we take advice from a whole range of other agencies and departments who are all involved in the crisis. Sorry, let me finish. Who are, thank you, James, who are all involved in the crisis cabinet structure. And when we've taken that advice, as you would expect, the government makes the decision.
You opposed it personally,
and
didn't you?
David,
last few questions.
Sorry, Andrew.
You opposed it, Mr. Hazard, in that meeting.
Andrew, I appreciate that you like the drama of interrupting every one of the other journalists who come to the press conference, but if you wouldn't mind, I'm currently answering a question. Back to you. So
it's not just health advice.
Hang on, sorry. So
it's not just health advice.
Finish, James. So when all that advice is taken into account, then the Cabinet makes a decision, and it's a collective decision, as you'd expect. You wouldn't want everybody to have exactly the same view, but at the end of the day, we come out with a decision, and it's a Cabinet decision, and I back our Cabinet 100%, whatever that decision be. Ashley.
With construction workers, why are you still letting construction workers from Greater Sydney go to regional areas and work on big sites?
Well, they aren't able to go from the 3 LGAs currently, and it's only if they are tested with what the public health people call surveillance testing. And it's like everything else. It's a proportionate risk issue that has been managed right through this, and we will continue to manage that until, as was said earlier, until we've got the vaccine. The answer is, I think people sort of forget that this is the second time we've had a pandemic in 100 years. The first pandemic was quite indicative of human response. So what happens is, you get through a certain phase. Human behaviour is you all go back to doing exactly what you did before. The result is, in the pandemic in 1919, they had a series of waves. That's been repeated in other countries around the world where they've had managed to reduce the rate. There is only one solution here. What we're doing at the moment is trying to manage it, but we won't get the solution until we get a high proportion of our population vaccinated, and we remain challenged by vaccine supply. Sorry, Sarah, can I come back to you? Thanks,
Mr. Hazard. You've just spoken about 1,000 times the viral load for Delta, so it's commonly acknowledged that it is considerably more virulent than the initial strain that put us into lockdown last year. Should Victoria come out of its lockdown, having entered its lockdown well after New South Wales, will the New South Wales government concede that with Delta, the go hard, go early strategy adopted by Victoria this time is what we should have adopted?
We did adopt a go hard. But obviously the advice varies from time to time as to the additional measures. But we had a very go hard, and I think if you could ask all the population who were affected 3 weeks ago, they would say it was go hard. Dr. Chant has referred to it as a hard lockdown, and it's just we've got additional measures.
But not go.
Sorry,
Mr. Hazard.
Sarah,
Sorry.
hang on, Sarah first.
The $10,000 fine not allowing the $10,000.
You mentioned go hard. You
$10,000
nothing about go early. So I'm allowed a follow-up question.
No, I'm actually talking to Sarah now. Sarah, go on.
Very deliberately, Sarah.
The $10,000 fine for employers who don't allow employees to work from home. Can you clarify if that's statewide? And at this stage, are you actively encouraging workplaces to shift to a work from home model?
What we're saying is the message is that we've doubled the fine for employers who might think it's acceptable to tell staff to come in. Dr. Chant and I and the Premier have all made the point that moving around is what allows the virus to move around. So we're trying to do everything we can to assist our community to not have to move around. Some employers, and I think it's only a handful, but some employers have been reported as still saying to staff, we want you in the office. Well, they've got to think twice about that, and there is a $10,000 fine that can be handed out on the spot, and of course a $55,000 fine that could be handed out if you go to court. So, but look, at the end of the day, you know, it's not the orders that matter, it's what we're asking people to do. And we're asking employers to try and be reasonable and understand that you asking your staff to come in means they might be bringing the virus with them and dropping it along the way with a whole lot of other people as they get to work. So just asking people to work with us as they have so well. James.
Public health orders are given as a guide. If they're just a guide, what's the point?
James, seriously, James, the orders are enforceable orders. But what I was saying was that you should not spend as much time as perhaps you are currently, and you haven't in the past, which I'm grateful, trying to find loopholes in them.
I'm not trying to find a loophole, I'm just trying to find the exact operation of the health orders, given that this was a situation that got
Andrew.
in the first place.
You want me?
Premier, about the economy. Sorry, and hopefully answer that afterwards. But look, it's clear this is going, I know you keep sticking to July 30, it's clear this is going longer. It seems to mean some form of lockdown. And it's clear that you've gone down harder than when the federal decision was made on the economic supports. Is it time for the return of something like lockdown JobKeeper?
No, I think what is really important for us to note is we're obviously working very hard to get out of this lockdown as soon as we can, but there's no doubt that everybody across Australia will need to live with some level of restriction until we get our vaccination rates higher. Some states have responded by shutting down their borders, other states have responded in different ways, but it's pretty clear that when we get out of this lockdown, and of course I'm not willing to give an end date just today until we get the data in the next few days and beyond, but what I will say is this: until we get our vaccination rates at a level which is going to protect the community, we will have to live with some level of restriction. And I think that's accepted, and we're looking forward to those extra doses in the end, you know, that are coming by the end of September, and by the end of October there'll be a much higher rate of vaccination. But having said that, please know that we're working as hard and as quickly as possible to get out of this lockdown as soon as we can. And by lockdown, we obviously mean those harsher conditions that all of us are having to live by. We want to see kids go back to school. We want to see people go back to as much normal life as possible. But we know that we can't completely live freely. We can't open international borders until we have much higher rates of vaccination. So until that time, we obviously have to make sure that we can live as safely and as freely as possible. So the challenge for all governments, and at the moment the most challenging for my government and for the people of this state, is to work out how we can best live safely and freely until at least the end of October, when those vaccination rates are much higher.
An unskilled labourer, though, earns $400 a day.
Yeah, sorry, Lucy.
Is your 10 million jab figure, is that formal government policy, that figure?
No, that was just an aspirational target we had set, which equates to about 80% of the adult population, or 62% of the population of New South Wales. As the leader of the New South Wales government, I was willing to put a target on the number of jabs we wanted before we could have conversations about opening up our state and living more freely. And I also think it's important not only to have the 10 million jabs, but also to make sure that everybody who wants the vaccine has access to it. And after that, we can make those decisions.
Just on the JobKeeper question, though, an unskilled labourer can earn up to $400 a day.
I'm sorry, I didn't get the beginning bit after the job.
Labourers can earn up to $400 a day. For their sacrifice, they're being thanked with a $600 a week payment. They would have mortgaged themselves accordingly. How do we expect people to live like that, potentially, as Andrew says, for more than 2 weeks?
Yeah, can I stress that obviously there are support packages in place now for individuals and also for businesses, and I don't want anyone to feel that they're going to go without the basic things they need to live safely in the next couple of weeks. But I also make this point that our job in getting out of this lockdown is to get kids back to school as quickly as possible, is to get people in their workplaces safely, and that is exactly what we're working towards. And that is why we've put in those extra difficult measures, because we want to get out of this thing as soon as possible. We want to make sure that our population can live, and this is key, as safely and as freely as possible until we get a large chunk of our population vaccinated.
Mr. Warboys, please. Our beaches, and maybe, sorry, Premier, but it might be addressed to you as well. The behaviour on the beaches consistently, Manly yesterday, Bondi, people don't seem to care. There was a photograph at Manly from a construction worker hosing down his site, finishing up because he can't work for the next 2 weeks, of people enjoying themselves in the sun on the beach. What do you think of that? And will there be more enforcement specifically on the beaches? Do you think the beaches should be closed?
I look, every single day police get disappointed with the inquiries that they make out the back of Crime Stoppers and complaints from the public right across New South Wales. We have a very large and agile police force. I suspect that down along the beaches, again, we'll double down our efforts there. This is about a shared responsibility. Police cannot be on every corner. They cannot be in every neighbourhood. But what we will do is we'll respond to where the people are that are seemingly not taking these public health orders seriously. And clearly it disappoints us around the beaches what occurred, and we'll have a stronger, more visible police presence. We'll work with local government as well, but we really reach out to people and ask them to take on their responsibility in what is a very challenging time.
So is it time to take some of the resources out of southwestern Sydney? Sorry, Deputy Commissioner. Sorry, is it time to take some of the resources out of southwestern Sydney and redirect them to the east and the north, where there are, these things happening?
That will be done. I said before that with 17,700 strong police force, we have a lot of resourcing still, and a lot of capability to move people around this state, or from police area command to police area command. We have specialist resources, our public transport command, our mounted police, we have police on push bikes, the list goes on. We're terribly well resourced to deal with the movement of our resources around where they need to be.
Thank you.